Good morning. Today we are going to present our case presentation, which is a case number 12 for a course CBC 622, which is directed by Dr. Crystal Soman. For a student, Fatima Rida, Jumana Najjar, Dua Saad, and Hadil Al Mubarak. And now, I am Dua Saad. I will talk to you about the contents of the case and radiographic interpretations. The general data of the patient: she is a female, 20 years old. The chief complaint is the patient came for implant in the region of the tooth number 36. The past medical history: she is a hypertensive patient. The past dental history: her lower left of first molar was extracted. The case history is: the patient came to oral implantologist for implant in the region of the tooth number 36. Incidental finding in the left articular eminence radiolucency, with no complaints or discomfort in the left zygomatic bone or skin over it. The radiographic investigation, as you see, is a panoramic, which indicate to the lesion. Now I will talk about the radiographic interpretations. As you know, any lesion it should be interpreted following 5 steps. First, location or site and number of the lesion. For this case, the location is on the articular eminence, on the left side and multilocular. The secondary is a periphery border, which is a well-defined corticated margin and scallop-shaped. The third interpretation is internal structure, which the lesion is a radiolucent lesion. The fourth interpretation is a size and shape. The size approximately about 1.5 to 2 cm, and the shape is oval shape with a well-defined border. The fifth interpretation and the last is effect on the surrounding structure. There is an alteration of the normal trabecular pattern. And now, my colleagues, they will continue to present the other parts. Thank you.
Assalamualaikum, my name is Jumana. I will complete with differential diagnosis. The first one, pneumatized articular tubercle. The second one, a numerizal bony cyst. The third one, giant cell tumor. Fourth one, osseous hemangioma. Pneumatized articular tubercle. Clinical feature: PAT is an air cell cavity in the zygomatic process of the temporal bone. Age 1969 years old. Radiographic feature: you can see in panoramic as unilacular or multilacular radiolucency defect. Numerizal bone cyst. Clinical feature: a reactive lesion of bone rather than cyst or true neoplasm. Occur individually below 30 years old. Female more than male. Radiographic feature: mandibular more than maxilla, molar, and ramus region. Well-defined circular radiolucency, mostly multilocular. Wispy, ill-defined sept like central giant cell granuloma.
Hi, my name is Fatma. I will continue from here. Then we have a giant cell tumor. The clinical feature: it is aggressive proliferative intraosseous lesion with fibrous tissue and hemorrhage and hemisidron deposit. It is located in posterior mandible and affected more often than the anterior mandible. The radiographic feature: it is a multiocular, less often uniocular, and it is well-defined radiolucent lesion. Bone may be expanded or teeth can be displaced or resorbed. Then we have osseous hemangioma. It is a benign vascular neoplasm which is mostly seen in vertebral bone, maxillofacial bone like the zygoma, the nose, or the mandible. It is in men more than women and typically seen in the 4th to 5th decade of life. May be completely symptom-free or may present discomfort, pulsation, swelling, facial asymmetry. It is uniocular radiolucency or multiocular radiolucency with a small honeycomb appearance or large soup bubble appearance. Philippolitis appearing as a small rounded or sausage-shaped radioopacity having concentric structure with a small radiolucent dot in the center.
Hello, my name is Hadil El Mbarak. I'm gonna continue the presentation. Definitive diagnosis. Pneumatized articular tubercle. Almost all of these entities are usually characterized by painful enlargement of the cheek and seen radiographically as expensive and destructive lesions. Management. Treatment of pneumatized articular tubercle in these cases is not necessary, and asymptomatic lesions should be kept under observation. Our references, and thank you for listening.